Tēnā koutou katoa, talofa lava, and welcome everyone to our Facebook live chat today on dental and oral health. I'm Chloe from our Plum Kit line team, and joining me today we have two very special guests. We have Lydia, one of our dentists here in Wellington, and her little girl Emelia. Hello, little one, our youngest guest so far, I'm pretty sure. So Lydia, do you want to tell us a little bit about what you do?
Thank you. So I'm a paediatric dentist and I work from the Hutt Hospital. I did my undergrad training in Otago and postgrad from Adelaide University. Been off on mat leave and had a little baby. This is Emelia, she's 6 months old. And yeah, big passion for children and teeth. So looking forward to the chat.
Cool, awesome, lovely. Well, thank you so much for being here, guys. So as always, if anyone has any questions throughout the chat on oral health, please do just pop them down in the comments section below, and we'll get to as many as we can. If you have questions about anything else at all, then you can always call our Plum Kit line nurses on 0800 933 922. Our nurses are here 24/7 for any questions you have about your tamariki and your pepe. So yeah, so let's get going. So I guess a really good place to start is maybe just asking, like, why are teeth so important for our tamariki, especially as little baby teeth? Yeah. What's important about those?
So teeth are really important for many different things. Mostly we need them for eating and contributes to speech. Baby teeth are particularly important because they're space holders and help with growth and development for getting the oral structures and the head and neck ready for their adult teeth, and also for children's self-confidence and self-esteem as well is quite important. So looking after them and preserving and maintaining their oral health is really, really important.
Cool. Yeah. Lovely. And when should parents start thinking about cleaning their little one's teeth?
So I mean, it's quite tricky to do. So I think when the teeth first start cutting through, it's quite nice to start brushing. More so for the toothbrush sensation, getting into the habit, and also she's just been teething, so she's just started to get her lower two incisors, and I find that she's quite loving chewing on things, and it gives that oral stimulation and some relief. So when the teeth start coming through, it's quite important. Before the teeth were coming through, we were wiping with a clean flannel in bath time just to get into that habit, because there's so many things to work around with the baby. I thought, you should start a routine. But yeah, as soon as the teeth start coming through, it's really important.
Cool, lovely. And how do you kind of get them to, when they're sort of past that stage of doing it with that cloth and you've got that brush there, what's some good tips for getting them to stand still, because they can be pretty active sometimes, our little one, and moving about. Some tips to get them to kind of stand still so you can make sure you're really cleaning stuff well.
Yeah. So I think the most important thing is to make sure that toothbrushing is a fun activity and not a chore. So giving children an option of the red toothbrush or the blue toothbrush, rather than we need to brush your teeth right now, but which one do you want to use? The positioning is also quite important. So at the moment we do it in the bath, and it's quite nice when they're lying down, so you pretend that you're the dentist and you get in the dental position to brush their teeth. So if they're lying down by their head or behind them is quite nice. You could also do it in bed when they're lying down as well. When they get a bit older and they're standing, brushing from behind is quite good. So if they're standing, you can brush if she's standing here. And can I borrow your toothbrush? And brushing them from behind like that. Up and down motions are quite good. Side to side at the front is quite nice, and then side to side, up and down at the back is also fine. I think ideally parents should help, but by all means give the toothbrush for the child to play with, because I think that also stimulates fun and makes a game out of it. The other quite handy thing that we can do is, we need 2 adults for this activity, but normally you'd sit in front of each other, so If you have 2 adults at home to help with brushing, you can have the child on your one adult's lap, and then the second adult has the baby or child on their lap, and then the second adult brushes the teeth, and the first adult kind of holds the arms and legs and body in place.
Lovely.
So they do get quite wriggly. And another option is you can just sit on them and brush their teeth. I think as parents there's so many things to worry about, and you just have to decide whether brushing is negotiable or non-negotiable, and how much drama you're going to cause with it. So it can be fun or it can be a drama. So.
Yeah. May as well make it fun, eh?
Yeah.
Keep it nice and light. It's a good way to go. Lovely. And when we're sort of starting out, is there a size of toothbrush that parents should go for in the beginning stages, the different sizes they can get?
Yeah, so I think we got given a really lovely one from Plum Kit, the baby one, and that's fitting in her mouth quite nicely. There are also silicone toothbrushes that you can get from the market, so we just got this from some store. These are good up until they've cleaning the front teeth, but when they've got molars then you really want toothbrushes with bristles. So I think we've got baby ones that you can buy, and then you just graduate as per size. Yeah. Okay. Yeah.
You know.
Yeah. So yeah, these ones are more ideal for your when the molars start coming through, because they've got lots of dips and grooves that the silicone brushes can't get into.
Oh. Awesome.
With the if they're not opening their mouth, like we said, make it fun, tickle them, do a joke, blow on their tummies, blow raspberries. Just make it fun, I guess.
Awesome. Lovely, lovely. And when should we start taking our little ones to the dentist?
The literature says between 6 to 12 months when babies start getting their teeth, but depending on the service and where you guys are at, sometimes it's at 1 year old, sometimes it's at 2. I think if you've got any concerns, definitely more than welcome to take them to their local clinic early. So in New Zealand, all children under 18 get free dental care. So between the ages of 0 to about year 8, they see the school nurses in the clinics. In Wellington, they're called the Be Healthy service, and they see the therapists. And then once they turn year 9 to college, they get allocated to a community dentist, and you can see a dentist for free up until 18. In terms of any accidents or trauma that children have with their teeth, whether they hurt any facial things or teeth or bones, that's all covered by ACC, and you see a dentist for that. Yeah.
Oh, lovely. And if you guys want to access your dental dental service near to you, there is an 0800 number which is called 0800 Talk Teeth, so that's 0800 825 583, and they'll be able to talk you through all the different services nearby to you and when they start up. That's awesome. And I guess it's always getting into that routine as well with the dentist, getting kids used to it, and it's forming that lifelong habit.
Absolutely. So a lot of familiarisation in their first couple of visits. I mean, they won't have many teeth in the beginning or not many problems, but it's getting used to sitting in the chair, meeting new people, practicing how to be a good patient. And I guess if the concerns, if you're looking out for and you want to see someone a bit earlier, dark stains on the teeth, any discoloration, any lumps or bumps in the gum that you think smells or looks a bit funny, and if you're worried about how the teeth are coming through, it's always quite nice to talk to someone, and it's free. So
exactly, things are absolutely free. Take advantage of it while you can, especially in the early years. That's awesome. Lovely. And how can parents do a check of their teeth just to make sure there isn't anything going on, like you said, that discoloration? What's a good technique of having a really good look in there?
So when you're doing the toothbrushing and the mouth is open, that's quite a nice time. The other option is doing the 2 adults. This is what I do at work. 2 adults, the knees touching, and then you lie them backwards, and the second adult can lift the lip and kind of do a tickle all around. And get the toothbrush in there and pull the cheeks open to look at the back teeth as well. And also using a spoon when they open the mouth, and you can kind of push things down into the side. And that's also quite helpful too.
Yeah.
Yeah, but lifting the lip is probably the most important thing.
Awesome. Lovely. You are loving these toothpaste already, aren't you, my darling? That's awesome. So we've got a couple of questions that have come in from people, so thank you so much for sending those in. And what if a child is swallowing rather than spitting
The toothpaste?
Yeah.
So very common. I don't think kids can spit until they're about 3.
Okay.
Yeah. So in New Zealand, we recommend to use toothpaste that is sold at the supermarket with fluoride in it, so at least 1,000 parts per million. So that can be this one, or the Peppa Pig one, or the Minions one. And it's quite nice to have all the kids in your household under 5 or 6 using the same one, so you're not having to buy lots of different toothpastes. And then we can manage the not spitting and the swallowing by the amount that we dispense for the child. So obviously we use a lot more than what a school age child would use, and a school age child might have a pea size amount, but for a small person like this, just a tiny smear or a tiny droplet will be fine. They don't get as foamy because you're not giving them as much, and then if they swallow, it's a tiny amount, but you've still got that protective factor. The other thing is, regardless of how old you are, toothpaste should be the last thing on your teeth before you go to sleep. So once you and I brush, we spit and then do whatever and go to bed, and it should be the same because we want the paste kind of lingering around in the mouth for that protection and to work overnight as well. So spit, don't rinse.
Yeah, awesome. Good stuff. Yeah, gorgeous. And oh, here we go. It's a question about teething. It's maybe a question for one of our nurses rather than us, but can you give painkillers with molars, and for how long? Is that something that you'd be able to advise on?
Yeah, yes, I think we just have to do what we have to do. Everyone needs to get their sleep. So we have been using pain relief on these littlest teeth already. I don't know what's going to happen with the bigger ones. So yes, definitely under the advice of your Plum Kit nurse or GP, give pain relief. And then there's no real... I'm not familiar with the literature on how long we can give it, but what is dispensed and prescribed would be a safe amount. But obviously we've got lots of other options with regards to natural things, so teething tamer and teething drops and powders. But I think all things get better with time, so just use what you need and use what you have to get through.
Exactly, and with things like that you can always call that Plum Kit line if your little one's feeling miserable. Just give us a call on that 0800 933 922 number, and one of the nurses can always just take you through. Like you say, whether it's pain relief, medicated pain relief, or something more natural like Lydia said, there's always options out there, so you're not alone. Always pick up the phone if you need us. And so with dental health, obviously brushing is a huge part of it. Also, it's what we put into a little one as well. So what are some kind of healthy snack ideas and things that maybe that we should avoid giving babies to make sure that their teeth are well looked after?
So I think something that we need to think about is balance, and it's not what we're eating but also how we're eating. So for good oral health, we're balancing what's going in our bodies and through our mouths, and what we're taking out with brushing and spitting and rinsing and all that kind of stuff. In terms of how we're eating, every time we eat anything, our mouth dips into an acidic flow, and as food passes through your mouth, you've got lots of different acids and sugars that pass through as well, and at those times we're more likely to get decay. So obviously the more you eat or the more times you graze through the day, the higher your risk of decay. So I know it's hard, but maybe giving bigger snacks or snacking less frequently during the day would reduce risk. That's one. In terms of what we're eating, obviously things low in sugar would be most ideal, and looking for healthy snacks high in calcium or are more basic. So if your child can have nuts, Nuts and seeds are a basic food and kind of neutralise a lot of acid. Drinking lots of water after you've eaten, also to rinse out any acids and sugars. Oh, sorry.
That is okay. You're keen on that bag, aren't you, sweetheart?
And then thinking about the fruits we eat, some are lower in acid and lower in sugars. So things like cucumbers and well-cooked veggies that are soft, lower in sugars, things like citrus things, maybe higher in acid, so just monitor how much you're eating. Strawberries are really good. And also lots of calcium in dairy things, so if your child is lactose okay. So lots of yogurts, no sugar ones, the plain yogurts are really good, and just add your own fruits, cheeses, and yeah, that kind of stuff. Did I cover the question?
I think you did, yeah, that was awesome. Yeah, lots and lots of good ideas there for people. That's fabulous. And I think you covered this one briefly, but just to go back to it, with the silicone toothbrushes, are they as good as regular toothbrushes for people to use? Are they as effective?
I think for babies without molars. So once you've got your lower four incisors and the top four, these would be fine. Add a little bit of toothpaste and brush. But once the molars, the back teeth come through, ideally you're wanting to use one of these, or a smaller one, a bristled brush, just because they get into the grooves and the crannies and the pits of the teeth, and they're a bit better at spreading the fluoride around as well with the toothpaste.
Cool.
Yeah.
Awesome. And then with little ones, another question we've had in from a mum from yesterday, so thanks for sending that through. When they absolutely refuse to open their mouths, when they're just clamping it tight shut, what are your main kind of tips for that?
So like we talked about earlier, making it fun, tickling them, using your fingers to tickle their cheeks to open their mouth. Sometimes some parents have found brushing in the bath to be quite nice. I mean, you get your toothpaste everywhere and you can just wash it off in the bath. And some other families have found using like a, when you put your towels on the heated towel rail and then you warm them up and wrap them up after the bath, and they're all kind of cocooned in, and you can brush it then as well. Or you can pop them on the bed all cocooned and brush them then as well. Yeah.
Awesome. Nice and relaxed sort of environment anyway. Yeah. Cool. Awesome. And we've got another question here. So, do we need to give yogurt with food, or is it okay to just be eaten by itself?
I'm not a dietetic expert or baby feeding expert. We've started the journey. I think it's fine, but I would probably check with the Plum Kit line.
What we'll probably do is get one of our Plum Kit nurses just to answer that question afterwards, just to kind of give their slant on it too. And like we say, any questions to do with food or kind of starting solids, it's always really good to give our Plum Kit line nurses a phone as well. They're always available on that number. So yeah, I think we have covered all of our hot points there. We've done our position, how to brush. So yeah, that is fabulous. Is there any other points that you want to kind of recap with parents about sort of starting that brushing teeth journey? Anything else you want to today?
No, I think we've covered a lot of it. But yeah, any questions, don't worry, call your clinic. Mums have enough to worry about. And do what you need to get through, really.
Exactly.
Yeah.
I think that is awesome advice. Yeah, take it slow. And everyone's different as well. If your little one hasn't gotten their teeth yet and other people are going forward, that's okay. Yeah. That's fine.
Some kids don't get their first teeth until 12 months plus, so it's less to worry about.
I was just about to say, it is less time with having their teeth
worry about decay.
Exactly. Less time with those teething pains as well. Let them have those lovely moments. Cool, but we are getting another question in, so thank you so much, guys. Cool. So with toddlers, should we brush twice a day for them? Yeah.
Literature says brush twice a day is ideal. So yeah, when you can. Morning, if you've got time, great. Just pick a time that suits you. before bed if you've got time, or after they come home from daycare, or before you go to daycare, or twice a day is great. Hit the teeth with toothpaste.
Yeah, I know. Twice a day. She's thinking, is it really twice a day? Oh, terrible. Terrible. That's okay. Oh. And for little babies, when you first start, is it once a day or is it twice a day for when they're a bit more little?
Yeah, I'll be honest, we're just doing once a day at the moment. Ideally twice a day, but just do when you can.
That's okay. Well, if the dentist say it's only you need to do it once a day, if that's all you can do, then I think that's.
I think also for toddlers, or when they start to get their molars through, if you can, you could get into the habit of flossing. Just between the back two molars, don't go all hard out with all the teeth. You've got too many teeth to clean. So just flossing the back teeth would be fine. Use a little bit of floss, chuck it through the back teeth, pull it through, or you can use the floss holders and just the little through. And just do 4 spots at the back of each quadrant, each corner.
Lovely. And that is a great habit to get into as well for later life. Yeah. Definitely. Fabulous. Lovely. Well, thank you so much for joining us today, Lydia, and thank you, Emelia, as well. Yeah. You have been an absolute star. I don't think anyone's been focusing on us. They've probably just been looking at how cute you are. So I think that's lovely. But thank you so much, Lydia, for joining us. Thank you. Oh, I think we do just have another question coming in, so I will hold back on my goodbyes for the moment. Hello, little one, but that's okay. We'll just go, hello. There's a smile. There's a smile.
Got your spitty freeway.
That's okay. Lovely. And you're already getting used to that toothbrush, aren't you, my lovely? You are. You've already got it in the hand. You're ready? Yes. You're going for it. Excellent. Cool. Yes. Cool. So is it normal, so the question we've got from someone watching, so thank you for writing in, is it normal for a tooth to come through halfway then stop?
Yes, teeth are very strange things. They come and go. You'll have a lump, and then you'll have no lump, and then they'll cut through the gum, then stop, and then come through a bit more. I don't really know why, but it sometimes takes a while. Good luck. Yeah, sorry.
Oh, that is absolutely normal. Oh, we know. That poor tooth, eh? It's taken its time, isn't it, Amelia? Yeah. It's taken its time. Yeah. Lovely. So if that is all the questions we've got for today, if there is anything else that anyone wants to ask, then like I say, please do give us a call at Plum Kit Line or give Talk Teeth a call as well. You can always check out our website as well. We've got some really great information about dental health there and oral health too. And the Ministry of Health also have some information on their website as well. So yeah, again, thank you so much for joining us today, guys.
Thank you.
It's been fabulous. And thank you everyone for joining in and watching us today. Hope everyone has a lovely rest of your Thursday. Ka kite, everybody. Take care. Bye.